Today's going to be fairly quick. We'll get right into the COVID report. Today, we're announcing 880 new cases of COVID-19. That's one of the lowest Tuesdays in months. Today, our positivity rate has now dropped to 3.94%, the lowest since September 21st. We currently have 551 Kentuckians in the hospital due to COVID, 147 in the ICU, and 81 currently on a ventilator. Now, we did have 21 deaths that we're announcing today, far more than we'd like, and certainly more than we had yesterday. They include a 74-year-old woman from Boone, a 71-year-old woman from Boyd, a 64-year-old man from Bracken, a 59-year-old man from Christian, a woman aged 91 and a man aged 60, both from Fayette County, 2 women from Greenup, 81 and 87, an 89-year-old woman from Hart, 3 women from Jefferson County, ages 62, 89, and 98, as well as a 60-year-old man, 2 women from Kenton County, ages 57 and 84, a 70-year-old man from LaRue, a 40-year-old woman from Laurel, a 84-year-old woman from McCracken, a 75-year-old woman from McGoffin, a 93-year-old woman from Pike, and a 66-year-old woman from Rowan. Only 2 individuals on today's list were in long-term care, again showing the power and the effectiveness of vaccines, and that ought to encourage everybody to get out and get their shot of hope. Long-term care facilities, 5 new residents testing positive, 10 new staff, 1 new death attributable to long-term care. These numbers are just so much lower than we are used to. That's a good sign. Vaccinations. We just finished up our last vaccination week. Remember, they start anew on Tuesdays. Let's start with Table 2. Last week, we set a record vaccinating 127,110 Kentuckians. That's right, 127,110. That beat the previous record by about 15,000. That was the week before, and that beat the record before that by about 30,000. So again, we are really ramping up, and we are going to meet this goal the president set of having a vaccine available for any Kentucky adult that wants one by the end of May. That's going to mean we have to continue to expand our locations. We hope to have more news on Thursday, where we are continuing to ramp up in our ability to meet the moment and to get people vaccinated just as quickly as we can get the vaccines. What you'll see is even with the amount that we had last week being the second most that we'd ever had, we still use 97.6% of all those vaccines within 7 days of receiving them, well over the 90% we hope to hit. Now, one thing to point out, last week we had that 130,000 vaccines because we got so many that came in from Johnson & Johnson from that first pre-authorized manufacturing amount they had built up. That was about 36,500. So for the first week in a while, we're going to have less this next week than in the last one. We're going to have 98,390 doses. But it looks like the following week, we've now been told we'll have a little more, or right at 8,500 additional Pfizer and Moderna doses, probably about 5,200. We might be able to order them this week and get them in, or they'll be next week Johnson & Johnson doses. We were told that we would have 0 Johnson & Johnson for this week, so that's a good thing. We'll also have about 4,500 extra doses coming into the federal pharmacy program, which is a good thing. So remember, we got a nice jolt bump from the pre-authorized but already manufactured Johnson & Johnson doses. That's going to be flat for a little bit, as will Moderna and Pfizer probably after this 8,500 dose bump for maybe a week, probably 2, and then we think it's really going to take off because both Pfizer's CEO has said we'll see a lot more, especially near the end of March, and the end of March is going to be significant. The end of April is going to be even more significant. So we expect by that point, again, to do 700,000 individuals vaccinated this month. We'll do even more than that in April. So really exciting. So if you've been frustrated, if you've been looking to get an appointment, it is coming really soon. Let's look at total people vaccinated in Kentucky, table 1. Now right at about 850,000 Kentuckians. 1 year and about 3 days, 4 days from our first case. That's pretty incredible. Again, over 25% of the eligible population now vaccinated, and we continue to speed up from there.